This short presentation is for you, my sister, who prefers maybe a more visual kind of approach. And I want us to talk about this program, the Fertility Foundation program. Maybe you've seen it there on this post, the Fertility Foundation program. Maybe you'd like to hear a voice behind this program so that you can truly understand what this is all about. So this program is for women who are trying to conceive. So if you're trying to conceive, you've been maybe trying to conceive, and you want to conceive maybe in the next 6 months to 1 year, this is for you. If you have hormonal issues, like you have hormonal imbalances, things like that, your estrogen, you have estrogen dominance, you have low progesterone, you have high prolactin, all of those people are hormonal issues. This program is also for you. Also, if you are feeling anxious or stressed up, or your environment could be not supporting you to be able to conceive, you may not know this, but if you are working maybe in a toxic work environment, you are not in a well supported relationship, all of these things can actually make your body feel unsafe to conceive, because that is the science behind it. Like, if your body is feeling unsafe, then that area in your brain that is called the amygdala will tell your body that, yo, this lady cannot conceive because she is very unsafe, and now we have to prioritize on keeping her safe as compared to reproduction, because reproduction as compared to safety here is a priority. So we're gonna also work with you if you're feeling anxious, if you're very stressed, you have or maybe you want to conceive, you've not been conceiving and you don't have any issues, then it could be this, like your body is feeling unsafe. So I also want to work with you. Also, women who prefer more natural approaches, like you don't want to just pop pills in your mouth and just hope that things are working. So you like doing things naturally, you like to heal from and balance things from the root, then I also want to work with you. So that is who I want to work with. And also, who is this program not for? Like, so if you've been in this trying to conceive space for quite some time, and maybe you've been to the doctors, they've told you that you need IVF or any assisted type of conception, then I may not be able to work with you. Also, if you've been already diagnosed, maybe you have endometriosis in severe degrees, you have endometriosis, you have PCOS, and you've not been under any follow-up by your doctors, your safety comes first, and I may not be able to work with you. Also, if you have other issues, for example, your uterus has problems, maybe anatomically, like there's some problem with your uterus, then I may also not be able to work for you. So I work with you. So basically that's it. And maybe one thing, so why should you trust me to work with you? So my name is Terry. Sorry, I didn't introduce myself, and I'm a registered nurse. I have over 10 years of experience in this field of moment baby. I have seen firsthand the suffering, the chaos that women go through when they are trying to conceive, especially after coming off, birth control, all of these issues, the hormonal issues. I have seen them, and I've also personally gone through the hormonal imbalances, and I've been able to balance them myself, and I would be, and I am so willing to help you go through this, successfully. Sorry. So how do we do this? So this 90-day program, how is it structured, or what kind of value are you going to get? Like, let's talk about this program. So it's divided into two. We have a group class or program or session, and then it's also comes with there's also a one-on-one, a private session. And in this, both of them, let me first define what a group coaching is. So here you and you here and a few more women will be inside this session. So it is a group. And a private just means it is just you and me. So this one is very private, it is very confidential. Also this one is very confidential, but you will have the luxury also of being in a community of other moms. But this one, the one-on-one private session, is for those women who prefer more private, more personalized kind of approach, and that's it. So what do we do in these sessions? So in these sessions, we are working on the mind. Let me change the pen here. So we are working on the mind, and with the mind here, we are regulating your nervous system, so that your nervous system, so that it can signal to your body that it is safe. No, we are gonna bring down the stress levels so down, so that your body feels ready to conceive. Because when your nervous system is unregulated, your hormones are also going to suffer. Your ovulation here is also going to be affected so much, and we can see that if the hormones are out of balance and you're not ovulating well or consistently, then conceiving is gonna be very, very difficult. So that is the mind part. Also, we are gonna work on the body. So here we're gonna learn about how to optimize, your ovulation. For those that don't have a menstrual cycle, like it's not regular, we're gonna regulate that. Regulate menstrual cycle. Also, we're going to improve your uterine health here, so that you can be able to conceive very easily, and also your cervical mucus. You know that without these four, it's going to be very difficult for you to conceive. So you may just be doing things blindly, but without ovulation, like you're not ovulating regularly, you don't have a regular menstrual cycle, your uterine health is not at par, and you don't have quality cervical mucus, then conceiving can be it's gonna be very difficult. So these are the two domains that we're gonna focus on, and this is a 90-day program. It's a 90-day program, and you may be wondering, like, why do we need all this time? So we need this time because it takes your body approximately 90 days, to form, to recreate or to replenish, or to trying to look for a word that is very easy for you to understand. Like, it takes 90 days for your body to fully replenish, like a new supply of eggs here. And it also takes at least 3 months, that is 90 days, for you to adopt new habits, because here we're gonna be doing things a little bit different. We're gonna be focusing on the nutrition bit, also on gonna be also focusing on some lifestyle adjustments, because conceiving requires it requires a very good dissection between the nutrition and the lifestyle. Like, you have to have a sweet spot in between, your lifestyle and your nutrition. They have to meet somewhere, so that your fertility can be optimized, because that is what we want to do. So it is not anything that is gonna be very difficult. Definitely no, I know we need something that is doable and something that has worked, and there for you for that. So that's it. So we need 90 days to fully reprogram ourselves, to fully reprogram our nervous system also, so that we can feel safe, to fully rebalance our bodies, replenish the eggs, regulate the menstrual cycle. So it is not a program for women who needs just to maybe just pop pills. Not really. No, we're not going to just pop pills. Definitely no, and it is not a quick fix. It is also not a quick fix. But generally, if you go through this program, you should expect the following. Let us go to the next slide. You should be able to feel calmer, and this means no stress, like very low stress. Your cortisol hormones is also going to reduce, and your body is gonna feel safe to conceive. Sometimes, most times, this is subconscious, like it is not a conscious thing. You may be thinking that, well, I don't feel stressed, but you're not conceiving and you don't have any issues. It could be this, because sometimes stress comes in very subtle forms. It could be a work project that is disturbing you. It could be your kids, could be your husband, it could be, you know, a work thing, you know, stress. Your body does not need any form of stress, whether conscious or subconscious. So we're gonna deal with that. Also, we're gonna be able to ovulate. I know we said that regulate your cycle, improve your uterine health, and all of these is aimed at improving or prepping your body and your mind to be able to conceive in, you know, naturally. So that's it. That's what I wanted to share with you today. And if you're ready for this, the next step is to just sign up. There's a link down there. Just sign up, click on that link, and then when you click on that link, you're gonna book a call. Like, you're gonna book a call through that link, and then in this call, you and I are gonna hop onto this call, and I'm going to ask you a set of questions, and these questions are gonna tell me whether you are an ideal candidate for this program or not. And then if you qualify to join this program, you're gonna either join the 90-day, sorry, my space has run out, the 90-day group, depending on your budget or your preference, or you can either opt for the one-on-one private session. So that's it. I really hope and I want to work with you if you really ready to become ready to conceive naturally within the next 90 days, then don't think any further. Sign up, hop onto this call with me, and then we get started. So my name is Nasteri. I'm gonna see you there.